Good morning, everyone. I hope you all are in best of your health. Please stay safe and stay at home. So we shall be discussing burns today. In our previous lecture of burns, we discussed what are burns, their classification, which is according to their depth, mechanism or mode of injury, and severity. Today we shall be discussing about what are the determinants of outcome of burns, response of the body to burns, and the criteria for admission in hospital for a burn patient. Determinants of outcome of burns are total body surface area involved. We had discussed this thing in our previous lecture as well. Depth of the burn, type of the burn, which includes the mechanism like electrical burns or steam burns, etc. Involvement of the respiratory tree, which is caused by the inhalational burns most commonly, circumferential burns, and of course extreme of ages. Now I'll be showing you a few diagrams which will elaborate the determinants of outcome of burns. You must have seen this picture in our previous lectures as well. This is the Wallace rule of 9. According to this rule, each body part is equal to 9% of the total body surface area. In children, it is a bit different. Then the severity of the burn or the depth of the burn is determined by the degree of the burn. First degree burns, second degree burns, and third degree burns. We had already discussed this thing in our previous lecture. You can see it from there. And this picture shows circumferential burns, which involve the limb or the body all around. So now we come to the response of the body to the burns. The first response the body gives is of shock. This is a reaction after burn. Now what happens? Burn produces an inflammatory reaction. It leads to increased vascular permeability. Water, solutes, and proteins move out from the intravascular compartment to the extravascular compartment. In a small burn, this reaction is small and localized, but as the burn size approaches 10 to 15% of the total body surface area, the loss of intravascular fluid can cause a level of circulatory shock. The volume of fluid loss is directly proportional to the area of the burn. Above 15% of the surface area involved, loss of fluid produces shock. Now, what are the multi-system responses to burns? When greater than 20% of the body surface area is involved, systemic effects are clinically seen, which includes hypovolemia. Hypovolemia is secondary to the loss of fluid and protein into the interstitial space. There is reduced cardiac output, which is secondary to the decreased venous return, and the decreased venous return is caused by vasodilatation, increased capillary permeability. There is inadequate preload, there is decreased myocardial contractility, and there is increased afterload. So there is pressure on the heart. Acute respiratory distress syndrome is secondary to the inflammatory response even in the absence of inhalational injury. This occurs in the respiratory system. Burn creates a hypermetabolic state, which is secondary to the release of stress hormones. What are the stress hormones? These are catecholamines, cortisol, and glucagon. And there is reduced sensitivity of the body to the anabolic hormones. The anabolic hormones are insulin and growth hormones. There is impairment of temperature regulation and increased muscle breakdown. All these hypermetabolic states clinically presents as tachycardia, hyperthermia, and muscle wasting. Now we come to the criteria for admission to a burn unit. First of all, we have to see if the patient has a suspected airway or inhalational injury. Any burn likely to require fluid resuscitation, that patient should be admitted in the hospital. Any burn that is likely to require surgery should be admitted to the hospital. Patient with burns of any significance to the hands, face, feet, and perineum should be admitted in the hospital. Patients whose psychiatric or social background makes it inadvisable to send them home, they should be admitted to the hospital. Any suspicion of non-accidental injury, that is, if you have suspicion that the patient has been abused, has been burned intentionally, so you should admit the patient and involve the authorities. Then any patient of burn who is at extreme of ages, that is, either the patient is too young, like a toddler, or the patient is old, like an elderly 60, 40, 50 years old patient with comorbids. Any burn with associated potentially serious sequel, including high tension electrical burns and concentrated hydrofluoric acid. These patients should be admitted to the hospital. So I shall be concluding my today's lecture till here. I hope you guys understood, and you may ask any questions if you have. I'm here to answer all of your questions. Thank you.